Yes, the vaccine has been proven to be very safe for pregnant women. It's much safer than getting COVID during pregnancy when there's a risk of both the mom and the baby getting sick and perhaps even dying from the virus. The American College of Obstetrics and Gynecology has approved the vaccine for use and recommends it, and you can see that on their website. Some patients may have a true allergic reaction to the vaccine, and if that's the case, we can switch them to another type of vaccine that has different components. So it's possible that there is a true medical exemption to getting the vaccine. There are other people who may not want to get the vaccine or need to get it at this particular time because they've had a dose of monoclonal antibodies, for example, that would prevent the vaccine from being effective. So there are some people that we advise to wait before they get the vaccine, but there are very, very, very few true medical exemptions to getting the vaccine. And please talk to your physician or get a consult from another physician if you think you've got a medical exemption to the vaccine, because they're so very rare. The CDC suggests we wear masks even if we're vaccinated, because it's clear that even vaccinated folks, when they get infected with the Delta variant of SARS-CoV-2, can shed it in large amounts in their secretions and thus infect others. So, and similarly, vaccinated folks don't really want to get infected with the Delta variant. Even though the vaccine prevents severe disease and hospitalization in most cases in vaccinated folks, there's still a small chance that that could happen. So wearing a mask is very important, especially if you're in areas where there's a lot of transmission of the virus. There's a risk that when kids return to school and start congregating with each other, that they could spread the virus amongst them. Remember that in the United States, vaccine isn't approved for anyone under the age of 12. Vaccine studies are happening for kids younger than that now, but we won't know the results for many more months. So kids are still vulnerable to the infection. And when they get together in school, we want them all to wear masks and all the teachers to wear masks still to prevent another surge from happening because of the reopening of the schools this year. It's very important to get kids back in school, but we want them to be protected at the same time. I think the United States is looking at another period where we're going to have more mask guidance, some travel restrictions, and the return of social distancing in certain areas of the country where there's a lot of transmission of the virus. It's inevitable, and if we can slow down the spread of the Delta variant of the virus by doing some travel restriction and wearing our masks more, it's well worth it. The Pfizer and Moderna mRNA vaccines have better protection than the single-shot J&J vaccine, but if you can only get one shot, just get the J&J one, and it certainly is doing a great job at protecting people. And if you have an option and you can wait, it's slightly better to get one of the two-shot vaccine series. Vaccine mandates have been used for more than 100 years since vaccines were first introduced by employers or by governments to get people to take vaccines in order to stop or blunt an outbreak. In many settings, being vaccinated to protect both the worker as well as the other people around them is an essential function and required for the person to do their job. And of course, the clearest example of that is in healthcare. Earlier this week, more than 50 major medical associations around the country came out in support of a vaccine mandate for all healthcare workers. Those organizations include the American Medical Association, the American College of Physicians, and the American Association of Medical Colleges. All the medical schools in the country are now advising that all healthcare organizations mandate vaccination for their workers. I think that's so important to protect not just the worker, but also the patients around them. The vaccine use in nursing home workers and retirement community workers is not as high as it should be. And people should remember that this pandemic really was started in the United States and was worst at the beginning amongst the elderly, vulnerable folks in nursing homes and retirement centers. So it's disappointing to hear that those organizations are struggling to get a 100% vaccination rate amongst their employees. And I would think twice before I would send my loved one to any organization that didn't have a vaccine mandate for their workers in the nursing homes. It's just a recipe for disaster again, and potential for harm to our most vulnerable patients.